Hello, doctors. Let's talk about a challenge that we're all too familiar with: prior authorization. It's one of those things that can feel like an unavoidable hurdle, standing between your patient and the care they urgently need. Whether it's a critical diagnostic test, a specialty medication, or even durable medical equipment, the insurance company's green light is often the first step before treatment can proceed. But here's the thing. While we may see prior authorization as a frustrating process, it's also a necessary one. Understanding it fully isn't just about jumping through hoops. It's about ensuring compliance, controlling costs, and most importantly, delivering timely care to your patients. So what exactly is prior authorization? Simply put, it's the process where we, as providers, seek approval from an insurance company before administering certain treatments or services. Insurers use it to determine if the care we're recommending is medically necessary and falls under the patient's plan benefits. Now, you've probably noticed that some services are almost always flagged for PA, like advanced imaging tests, specialty medications, or even treatments for rare conditions. And here's the kicker. The requirements for prior authorization aren't just insurer-specific. They can vary between plans from the same insurer. This means staying updated on these ever-changing guidelines is critical to ensuring smooth workflows and avoiding delays. So why does this process exist in the first place? From the insurer's perspective, it's all about managing resources, controlling costs, preventing misuse of services, and promoting quality care by aligning with clinical guidelines. On paper, it makes sense. But for us, it can feel like we're navigating a maze, one that eats into precious administrative time and delays patient care. And those delays? They can be significant. A stalled approval for something like a surgical procedure or a cancer treatment doesn't just disrupt your workflow, it can directly impact a patient's health outcome. And we haven't even mentioned the denials yet. Those rejections that require resubmissions, appeals, and endless back-and-forth communication with payers. Let me give you a real-world example to paint a clearer picture. Imagine you're submitting a PA request for a growth hormone stimulation test, CPT code 80428. The process involves checking eligibility, entering diagnosis codes, uploading documents, and waiting for a response. After all that effort, you find out that prior authorization wasn't even required. Frustrating, right? This is why getting the process right matters so much. Now, this is where outsourcing can be a game changer. For many practices, partnering with an experienced team like Staffingly Inc. has transformed the way they handle prior authorization. Staffingly specializes in streamlining these time-consuming processes, whether it's eligibility verification, accurate documentation of CPT and diagnosis codes, or navigating those payer-specific portals to minimize errors. They even handle follow-ups and appeals so you can focus on what really matters, your patients. With outsourcing, you could save up to 70% on staffing costs, reduce delays, and free up your clinical staff to concentrate on care instead of paperwork. And let's be honest, wouldn't it be great to hand off this administrative headache to someone who does it better, faster, and more efficiently? At the end of the day, prior authorization is a necessary step in today's healthcare landscape, but it doesn't have to be a constant roadblock. By understanding the process, anticipating challenges, and leveraging solutions like outsourcing, we can reduce its impact on our workflows and get back to what we do best, providing exceptional care. So doctors, if the PA process feels like it's taking over your day, consider reaching out to Staffingly Inc. to simplify the process and reclaim your time. Thank you for listening, and as always, here's to smoother workflows and healthier patients. Take care, and see you next time.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.